I'd like to take a moment to introduce you to some of the exceptional nurses at Rideout Health. And from the Chief Nursing Officer to you, Happy Nurses Week. When I was 5, my parents gave me as a Christmas gift a nursing kit. And I immediately opened up a clinic. I took care of all my sick dolls as well as all of my friends in the neighborhood. I had a 100% success rate, and I decided at that time that that was going to be the job for me.
I've always wanted to be a nurse from the time I was little, but actually working in labor and delivery and perinatal for about 7 years as a secretary just kind of reinforced that need and desire for a little bit more to give back.
I would have to say, even with all the ups and downs in this field, I don't think I have ever for a second regretted the choice I made to become a nurse. It has been the most rewarding, interesting, blessed job. I can't imagine having done anything else.
Since I was 12 years old, my grandpa had open heart surgery, and I watched the nurses around him help him, and I was completely inspired at that moment and looked at my grandpa and told him, one day, I'm going to be a heart nurse. That same physician that operated on him came back to Rideout and actually bridged our program for a little bit. Dr. Kupi Shankar. He looked down at me after I lost my grandfather and remembered the little Sarah at the bedside and said, your grandfather would be proud of his little heart nurse that you became. And I know every day he's smiling at you. I'm very, very proud of you. And so am I. You never gave up, Sarah. I said, nope. So I feel blessed to have worked with him as well, who also saved my grandfather and gave me 20 more years with him and some incredible memories. Now I get to pay it forward and do that for many other grandfathers and their granddaughters.
I see my role as making sure that everything that needs attention gets attention for my patients. It's a role of communication, it's a role of nurturing, it's a role of technical administration of processes that the hospital designs. It's making sure that things happen as they're supposed to, when they're supposed to, just sort of pulling things together. And the eyes and hands on the ground for the doctor. That's my role and more.
I see it from the very beginning. My job as an admissions nurse is to first check over the admission orders, make sure that the medications are correct, make sure that any wound issues are addressed, and it just goes from there. Just meeting every single aspect of a resident's needs. That's how I try to ensure their safety and care.
I think advocating for a patient's almost a daily occurrence with hospice, mainly because it's their last journey in life, whether it be for pain management or just even the psychosocial aspects of the dying process. So I think actually advocating is something that the hospice team we do on a very daily basis.
Patient advocacy for me is being the person, the go-between for your patient and physician or any part of the organization that that patient might need to contact. Sometimes patients are afraid or they don't know where to go or who to go to, or even sometimes they're hesitant to share information with maybe even their physician, or maybe they've forgotten to say something, and you're that person that talks for them.
The patients that we see oftentimes it is one of we're seeing them on their worst day.
But it all kind of came together for me when I started working here, because suddenly I was forming long-term relationships. We take care of patients from weeks to months to years. And they have so many problems, and it's not just a patient that has the problem, it's often the family that you're dealing with. And they can get so lost in the system because there's so much going on. So there's the social aspects, the medical, the physical, the mental, the spiritual. And you really have to look at that, all of that, and really advocate for them. It's so easy for something to get lost especially in the patient who's dealing with a diagnosis of cancer. So I probably never advocated so much in my life as I have since I became an oncology nurse.
You never know exactly what you're going to walk into a patient's home doing home health, but I always try to educate them, and most of the time they comply, and we pick up rugs that they can fall over, clear pathways. If they need a sharps container, we talk about disposal of things. There are all kinds of things that I try to do to help them stay safe in their homes.
They're under anesthesia and they're unable to make the decisions for themselves. So being that recovery nurse and the pre-op nurse, it's very important to make sure during the surgery and before the surgery and after the surgery, while these patients are under anesthesia, under sedation, that we do the best for them, provide the best care for them, make sure we do the best outcomes for them, where at that situation where they're unable to make that decision for themselves.
Having a baby is a lot different, especially for the first timers, than what they've seen in the movies or what they've read in books. And it's helping them recognize that what's going on with them and their baby, either the pain they're feeling, or their baby doesn't sleep as well as they hoped, or breastfeeding doesn't go as well as they hoped. The thing I love about my job is being able to help them recognize that that's okay, and not to beat themselves up or to get down on themselves for that. That's my favorite part of being a nurse, is working with moms and babies. I have several children of my own who are all grown, and even though I'm a newer nurse, I love the fact that I have a lot of experience with babies and children, and I feel like I use that experience to help my patients get through this particular time in their lives and make it a little more special for them, hopefully.
Patient advocacy means to me that I am trying to get the best care and the safest care for patients, whether it is at the end of their life or at the beginning. They're advocating for what their needs are, not just what they want, but what they need to be safe and healthy.
So advocating to me means being that voice for that patient and that family. I feel blessed to be able to be in a profession that I'm able to advocate for people without a voice and have meaningful impact on both the patient and the family's lives.
I guess I look at patient advocacy as I'm the middleman for everybody, communicating between the patient and everybody else that they need to interact with.
Every nurse has that one story where they truly look back and think, you know what, I made a difference, or I made a patient feel better, or I kept them safe. I believe every nurse at Rideout Health attempts to do that every single day.
Recently on 3 Main, we had a woman who was struggling a bit. She was in an isolation room. Her husband was at her bedside, and she had undergone a lot of trials, so to speak. She was post-chemotherapy and just having difficulty. And she and her husband had been married for about 56 years, and he was very concerned. And I remember on a particular day when she was having difficulty breathing, and he was really worried. And he started calling for a respiratory treatment. He wanted her to have a respiratory treatment. And he was kind of panicking. I knew he was frightened, and for him that sort of translated into anger. And he became a little bit belligerent with the staff, and maybe a little bit difficult to manage, but it wasn't respiratory that she needed. She was in fluid overload, and so I called the doctor, and we got an order for Lasix. And as she started diuresing this fluid, she started breathing more easily. And the man who was her husband, I mean, you could see as the patient was improving, he was improving. It's like they were both kind of softening together. And at the end of it, he started apologizing to me about his behavior, and we see it a lot. But this man said to me, I just don't want to lose her. And that just sort of swept over me like a wave. It was sort of recognition that you're not treating just the patient, but the whole family, and that what you do makes a big difference. And the things that may seem kind of small in the moment are pretty important and pretty powerful in the scheme of things.
Well, probably a case that stands out for always in my mind is and it's kind of lengthy, so I apologize. But I started taking care of a 25-year-old girl. This would have been 11 years ago. She had stage 2 breast cancer, and she was young. She was 25. So I first advocated for her because there was some lacking in teaching, and we went over everything from side effect management to she was young to her self-esteem to body image to her sexual life. So all of those things we talked about. So she's diagnosed in 2005, goes through treatment through 2006, and then she's done, and off she goes to lead her life. And she moved away and got married and became pregnant. And in 2009 delivered a healthy baby, but unfortunately her cancer had come back. And so she, 2 days after delivering her baby, found out that she had widely metastatic stage 4 breast cancer. And so she's not even 30 at the time, 3 kids, newborn baby. And she comes back to us because she lived away and actually came back because she loved our treatment, the nursing care and the physician care here. And so that was in 2009. She was originally, said, hey, get your affairs in order. So it's been 7 years, and she's still an amazing person who I feel I've advocated for to get her best care. And even when her young son was also diagnosed with cancer, with an osteosarcoma, and went through a horrible battle, lost his leg to cancer, and he would come with his mom to treatments. I would be giving her treatments, and then I would be helping him with his math homework, because he was in junior high at the time working with positive and negative integers, that I absolutely, unbelievably, that I could remember how to do it. So he was, of course, a pediatric patient. We didn't take care of him, but he came with his mom on his way, and so I got to know him very well too. And so part of my job as a nurse wasn't just taking care of her and her needs, but also taking care of his needs, even if I wasn't giving him chemo. And then through that course, as we've come to know each other, he lost his battle at 16 to cancer, or 15. And now I advocate for it in more of a spiritual and emotional way because we have this bond.
I had a little girl that I was taking care of many years ago. She had had a heart surgery, not a transplant, but a repair. And she was failing pretty badly. I had been on the day shift, and now it was the afternoon shift. And the surgeons were down in OR, and she was dropping her blood pressure and her vital signs, and we had to call down to OR. And you know how sometimes when the surgeon's in OR, but this is a teaching hospital, so there wasn't just one surgeon. And it was a very strong, please come up now. No, we've done all that, please come up now. We're losing her, please come up. And the surgeon came up, and the little girl was in cardiac tamponade, and they were able to release that pressure immediately, and her little face pinked up, her color came back, and I saw that little girl go home. It was probably one of the most rewarding times, days, memories I've ever had. Sorry.
We had a patient who was having lots of pain, and while doctors at UC Davis were trying to help with that pain, they were giving large amounts of narcotics and different types of narcotics, and the patient didn't want to be in that state. They wanted to be as alert as possible, and working with our medical director, we were able to go ahead and get him on a path to medication base that was able to be effective, but not making him so comatose that he couldn't enjoy that last periods of his life.
A doctor's office sent a referral over to us, a local doctor here in town. He was concerned about a patient. The patient had been missing his appointments, and there was some question about med management. So I'd gone out to his house way out in the country, knocked on the door, didn't hear anything. I was gonna leave, and then I heard a thud. And I thought, okay, this is an elderly patient. I better try and see if there's something else going on. So I went around to the side of the house, and I looked through a window, and there he was reaching out, his little hand shaking, and he was very frail, thin, pale. And I said, sir, it's Diana with Rideout Home Health. Can I help you? And he kind of motioned with his hand to come in. I opened the door, stepped inside, and then there was a smell of feces and urine. He was half dressed. Urine, you could see it soaking all the way up to his chest. And he was reaching out to me saying, do you have anything to eat? I'm so hungry. I'm so hungry. And my heart broke. I was angry. I was thanking God that I was there and that I was in a position to help.
I'm so amazed that the frontline staff at Rideout Health have really transitioned from completing tasks to making the patient and the families the center of their care. This is the ultimate way that we can actually keep patients safe by understanding and knowing what their needs are and where they come from and where they're going.
My greatest asset for my patients is that I care about them. I listen to them. I pay attention to them. I'm present with them while I'm during my assessment. There can be 1,000 things going on in the back of our heads as nurses, and we're, even as they're talking, we can tend to kind of check out and keep reprioritizing and keep thinking about what we need to be doing. And multitasking is great, but I try my best to really pay attention to them, really listen to them, because I care about them. And I know that whatever experience they're having in our emergency room can be one of the most frightening experiences maybe that they've ever had, or just a real feeling of helplessness or even hopelessness.
So really, to advocate for patients, we really need to listen to them, take those extra few moments to sit down, find out what their needs are, where they're going, where they came from. Their story will actually be able to tell us what we need to do for the patient.
Being kind, being compassionate, listening to your patient's questions, giving them the information that they need to be a big part of their care so that they can make informed choices in their care.
Probably the biggest skill is listening, I would say. If you don't actually pay attention with the nurse, what your patient is saying, you won't hear what they're saying. So being a good listener and then knowing where to go with that information.
That's one of the hardest things, I think, for nursing staff, is to recognize that when someone says they're in pain, what they're feeling is legitimate pain, regardless of what their history has been coming into the situation or what preconceived ideas we might have, about them.
Well, I think there's several qualities that are important to be a good nurse, and I think one that we probably always hear over is, of course, compassion. But I think it's more than compassion. Obviously, that's important when you're a nurse, is to be compassionate, but I think you have to also, it's passion that I see. It's passion not just for your patients, it's passion for your profession.
I believe that excellent care and service should be delivered to our patients, every interaction, every patient interaction, every time.
As a clinical instructor, I always try to make clinical assignments based on the needs of the unit, but also the needs of my clinical staff. There's one particular patient that stands out. She was in her early 20s, was diagnosed with Guillain-Barré, very anxious, had a lot of pain issues, and really required a lot of care. The clinical students that I had with me at the time, they truly embraced this patient and really showed empathy, caring, compassion. And so I would have to say that as we begin to mentor and coach and guide the future nurses of America today, we really need to make sure that we're not just teaching them skills to hang an IV or give a medication, but also about compassion and how to really care for people and make sure that they have those skills before we allow them out into the workforce.
Use your whole self in caring for people. See them as people. Use your eyes to see everything that's going on and put yourself in their shoes.
There's such a variety of areas that you can work in, and you need to find what area makes you happy, and then do it to the best of your ability and be enthusiastic about it.
Nursing requires you to be passionate, compassionate, patient, and knowledgeable.
Oftentimes, I know that I'm going to ruffle a few feathers, and the doctor might not like what I have to say. My supervisors sometimes don't like what I have to say, but it's important that I do my best for the patient and that I can go home and sleep at night and say that I did everything that I could, because in that whole situation with the little man that I found, it just felt like it went beyond a job and being a nurse. It was like, as a human being, I had to get that guy out of there.
As nurses, our personal feelings need to not be part of our care.
We are the patient's voice and essentially the family's voice as well, and that our main role is to never not stop being that voice for that patient and family. That they depend on us in a time that they're most vulnerable and that they most need us to be there for them.
I think nursing is just a good avenue for me to just show that I care about others.
But nursing is people need you, and that answers something in the human being, I think.
I always knew I wanted to be a nurse, but I kind of went a different route, and I am here now, and I love it. I can't imagine anything else. I truly feel complete. It may sound cheesy, but I do.